Recorded Books presents Mayo Clinic on Prostate Health. Answers to questions about prostate enlargement, inflammation, and cancer. Written by Derick J. Lomas, M.D., and Paras H. Shah, M.D. Narrated by Winton. Part 1. Prostate Basics. Chapter 1. About the prostate gland. The prostate gland can cause some of the most common health problems that men face, and cancer of the prostate is among the most feared. That's because prostate cancer, like breast cancer for women, often strikes at the core of human sexuality. Beyond the fear of cancer itself are the possible consequences of treatment, issues with bladder control, incontinence, or sexual complications, including erectile dysfunction, loss of ejaculation, or changes in orgasm. These problems can be as difficult to deal with as the cancer, eroding your self-confidence and evoking feelings of lost masculinity. But there's reason for optimism. If caught early, prostate cancer often can be successfully treated and cured. Improved practices are reducing the risks of incontinence and erectile dysfunction. And when these complications do occur, treatment may limit their effects. It's also important to understand that cancer isn't the only prostate problem. Inflammation and benign enlargement of the prostate are even more common developments. Unlike prostate cancer, these problems generally aren't life-threatening, but without proper treatment, they can become painful and even debilitating. Prostate problems are a fact of life for many men as they get older. However, with regular checkups, you can reduce your risk of serious disease and keep the condition from significantly disrupting your quality of life. This book can help you better understand why prostate problems occur, identify symptoms early, and allow you to make informed decisions with your doctor regarding treatment. A prostate primer. The prostate gland consists of smooth muscle and spongy tissue containing thousands of tiny glands and ducts. Two major types of cells make up the organ. Epithelial cells are found in the glands. They secrete the fluids used to produce semen, the fluid that transports and nourishes sperm. Stromal cells include connective tissue and smooth muscle that supports the epithelial cells. The prostate also produces an enzyme known as prostate-specific antigen, PSA. This enzyme is vital to the reproductive process because it helps break down semen once the semen has been delivered to a woman's vagina, allowing the sperm to be freely mobile. The prostate gland contains 3 sections, zones, that are separated by distinct structures and functions. The peripheral and central zones contain most of the prostate's glands, where semen fluid is produced. If prostate cancer develops, it's often in the peripheral zone, and then it spreads outward. The transitional zone, which surrounds the urethra in the center of the organ, is the part of your prostate that enlarges during the later growth stage that takes place in your 40s, exerting an inward pressure that can cause benign prostatic hyperplasia, BPH. A healthy prostate. Found only in men, the prostate gland lies at the base of the bladder. As urine drains from the bladder, it passes through the prostate. At birth, the prostate is about the size of a pea. It continues to grow until about age 20, when it's roughly the size and shape of a walnut. The gland remains this size until your 40s, when it often starts to grow again. This second growth spurt is associated with prostate problems. Treating prostate conditions can be difficult because the gland is bundled among many delicate organs, muscles, nerves, and blood vessels. This is why side effects such as bleeding, incontinence, and erectile dysfunction are always a concern. For example, prostate surgery may injure the nerves leading to the penis, causing erectile dysfunction. Due to its location, the prostate gland plays a key role in the function of your reproductive system, as well as your urinary system. Reproductive system. Tiny glands in the prostate gland manufacture most of the fluid in semen. Ducts then carry this fluid to the urethra, the same channel that carries urine from the bladder out the penis. During orgasm, prostate fluid mixes with fluid from the seminal vesicles, located on each side of the prostate, and with sperm to form semen. Sperm travel up from your testicles through long tubes called the vasa deferentia. Muscle contractions cause ejaculation, during which semen is propelled through the urethra and out the penis.
Sample complete. Ready to continue?